Welcome. I have here with me representatives from an international group and locally based groups, from a human rights group and humanitarian groups. First, we have Grazia Careccia.
Hi, I am the Deputy Regional Director of Middle East and North Africa Program at Amnesty International Secretariat.
Welcome. Aseel Baidoun.
And I'm the Deputy Director of Advocacy and Communications working at Medical Aid for Palestinians.
And Tirza Leibowitz.
Hi, I am Deputy Director with Physicians for Human Rights Israel.
Welcome. First, let us start off. How did you arrive at the conclusion that Israel is committing genocide in Gaza?
So in 9 months, we analyzed a large number of satellite imageries. We conducted 212 interviews with survivors, witnesses, expert witnesses, including colleagues in the humanitarian sector. And the picture was very clear that there was a situation of not only civilians being killed, but also there was the creation of a system in which people were subject to great physical and mental harm. And slowly we understood that the violations of international humanitarian law weren't simply that only, but they were part of a situation in which the conditions of life created in Gaza were clearly indicating that the intention behind these actions was to destroy the group. We also analyzed a large number, over 120 statements issued by the leadership, Israeli leadership, political leadership, military leadership. Why? Because in order to prove genocide, we don't only have to prove the material acts. So the fact that people were killed, they were subject to physical and mental harm, that the conditions of life, such as destruction of medical infrastructure, but also the lack of access to essential supplies was becoming clearly of a level that we hadn't seen before. In the first few weeks of the military campaign, we saw a total closure of the Gaza Strip, so nothing entered the Gaza Strip. But again, as I said, genocide needs to be proven also with intent. So what is the objective? What is that's been aimed for? And clearly the statements that were issued were pretty clear. The level of dehumanization had reached unprecedented peaks, with the infamous statements that would rather not mention again, in which Palestinians were deprived of their humanity. And these statements were then translated into action by the soldiers on the ground. So not only leadership in the Israeli political spaces and military spaces were calling for violence, unprecedented, were calling for no distinction between civilians and those who were taking part in the hostilities, were calling for stopping any access to essential supplies, water, food. No food will enter Gaza, no water will enter Gaza, no electricity was produced because of the lack of fuel as well. So, and these actions were also, they were taken by soldiers of, glorifying and taking pride in violating the rights of Palestinians with total impunity. They could easily post their actions on social media, and we reviewed hundreds of videos in which they were very proud of their actions. Well, and these actions were met with no accountability. And for us, then the picture was clear. Not only statements, actions by the military and actions by politicians to support with the narrative. So genocide was happening, and that's what we established in December 2024 in our report, 300-page long report, to give the full picture.
How about you, Tirza?
Focus is always on the medical side, and it is an extremely helpful lens in assessing and determining whether there is genocide, because we are talking about an extra protected category. We're talking about hospitals that should be protected, are protected under international law. So that's one aspect. And if we see a massive violation of those protections, that already is an indication. But what we saw here was beyond that. Looking back, if we look at even the first week of the attack on Gaza in late October, already then there was a massive issuing of forced evacuation of 22 out of the 36 hospitals. So that already indicates a systemic kind of action. And the fact that it's hospitals, a way to reach and to actually harm a population, how more than through extreme, significant harm to the system that every community needs, which is the health system. And so when we were piecing together, we were doing the regular kind of human rights documentation. We do that over the years of harm and violations in particular instances. Here, we saw piling up from multiple perspectives. The massive violations and the harm to the population in Gaza. So one, which also Grazia mentioned here, is the massive bombing, including of hospitals, and the harm to people, to civilians. In addition to that, we follow the population, what happens to the population when a whole part of the Gaza Strip is bereft of hospitals. Then you see massive movement of people and trying to receive healthcare elsewhere, which creates extreme pressure in other regions of the Gaza Strip. We see the accumulation of illnesses and disease in addition to those injured who are not receiving care. We're documenting the massive harm through both detention and through killing and injuring of the healthcare sector. So a whole generation of doctors, nurses, paramedics who have been killed, and also the massive detention of hundreds of healthcare workers, including just when you start actually going through the roles of those who have been detained, what you're seeing is like the spine of the health system. We see hospital directors in Shifa Hospital alone, 6 hospital directors within Shifa who have been killed. Several hospital directors as well who have been killed. Others who have been detained, and some continue to be in detention. And
Aseel, when was the tipping point when Medical Aid Palestine said, okay, it is a genocide?
For us, the tipping point was with the consistency of the testimonies from all the doctors, MAP doctors who visited Gaza, from our colleagues, when they all described one thing, that the Israeli army is destroying the people in Gaza as a whole. And we, again, as MAP, we work in hospitals, and witnessing the Israeli army attacking every hospital, making sure that people have no access to medical care, that people are killed in masses indiscriminately, that Israel is targeting directly the healthcare sector and targeting doctors. We kept witnessing that for maybe a year and I don't know how many months, until we reached a point that this cannot be anything else but a genocide. We cannot say that it's only mass killing of civilians, but these civilians have no option but to either die from hunger, as Israel used starvation as a weapon of war. They also weaponized aid, like even us as Medical Aid for Palestinians, we were unable to access Gaza and deliver the aid that is needed. So not only they targeted with military equipment the Gaza Strip, but they also made sure that they deny all the life essentials for a population to survive. A famine was declared. People were either dying from malnutrition, diseases, or direct killing. So in total, we couldn't stay silent, even though we don't have the legal analysis, like we don't have legal experts on the ground. But I think reports from organizations like Amnesty and from UN experts and physicians for human rights, with the testimonies of our own doctors and colleagues, it was more than enough for us to conclude that what was happening for all people in Gaza was not a war, but a genocide.
The bombs stopped falling, but not much changed on the ground. The world is dangerously looking away. The three of you are here today to say and prove that the genocide continues despite the what's called ceasefire. Could you please elaborate why?
Well, genocide is a process, and it started, as we've seen, to unfold and to have this massive impact, not only in the number of people who've been killed, in the number of those who've been rendered disabled for life, and those who are prevented to access from medical assistance as needed. So the impact is an ongoing process. So it is what we are seeing today, a continuation of what we've seen since October 2023. Therefore, we believe that genocide is ongoing, and still a lot needs to be done for this to be reversed. It is very clear that genocide is ongoing, and it is very clear that accountability is nowhere to be seen. And without accountability, there is no end to genocide.
Tirza.
And as noted here, to reverse some of the harm we would expect to see, for example, open movement into Gaza of everything that is needed to rebuild. We can talk about the health system. There are many other systems, but let's focus on the health system. The restocking, massive restocking of every kind, because every kind of equipment and medicine has been depleted or near depleted. That's not happening on the ground. To see particular kinds of treatment coming in massively to somehow reverse at least some of the harm of starvation, that is not happening either. To see the ability of Gazan residents to access medical care like they did before October 2023, many of them for the more complex needs would go to the West Bank. It was an integrated system. That is not happening. Just a few days ago, yet another delegation of a medical team and doctors were stopped at the borders from entering Gaza. So, so many have been killed from the physicians, and the even international staff who are coming to volunteer are being stopped. So all of these, it's an active maintaining of conditions that do not actually allow to come out of a situation of genocide.
Aseel, why does MAP UK think that the genocide never ended?
So at MAP UK, we still did not conclude that the genocide did not ended, not because it didn't end, because we still did not publish anything yet. However, I'm here to second the opinion by proving what's happening in the medical sector for now. So since the ceasefire, the Israeli violations did not stop. All the doctors are reporting that the situation at the hospitals is still as catastrophic. Less than 10% of the needs of the hospitals and the Ministry of Health has been met. Israel is still restricting aid, and they're still not meeting the agreement where they said that the aid should be allowed in scale. And doctors are also reporting even harder conditions. For example, 40% of patients with kidney failures have died already because of lack of treatment. And that also includes all other chronic patients who have not got the right treatment for more than 2 years. So the situation in the hospitals is still as catastrophic, if not worse. 50% is not functioning in terms of the capacities, and the other 50% are only partially functioning with really minimal medicines, because no essential medicines was allowed since the ceasefire. So all the people on the ground in the medical sector are affirming that nothing has changed since the ceasefire. We still have many and several doctors and healthcare in custody. In addition, like what you've just mentioned, Israel has killed more than 1,800 healthcare workers, so leaving a really scarce and limited capacity in doctors. At the same end, they're not allowing emergency medical doctors to enter Gaza, and they're also not allowing international media to enter Gaza. They're not allowing international investigators to enter Gaza. And this all piles up to the one issue: how can genocide end by a ceasefire that is still violated on a daily basis by Israel? Israel has killed more than 250 Palestinians and injured more than 600 since the ceasefire with full impunity. Why? Because the ceasefire was the answer of a genocide. The perpetrators were not held accountable. No one asked Israel what will happen to all these soldiers, commanders who committed the worst, the hideous of atrocities against the Palestinians. It just ended with a ceasefire that Israel is still violating on a daily basis with full impunity. So I don't want to say that genocide is continuing, but can the genocide end where the perpetrators are still controlling Gaza, where they're still killing Palestinians, and where the health sector is still dismantled?
Let's stay in the health sector a little bit. How are the different practices Israel is implementing directly killing people day to day? So how is the limitation of the medical equipment killing people? How are they dying softly now that the bombs are not hitting the ground?
Well, in July 2025, so a few months ago, it was stated that famine was full-fledged, operating, present in Gaza. 13,000 children were admitted into hospital for malnutrition-related problems, health problems. 13,000. So, and to reverse this situation is certainly not the entry of a few drops of food that would change it. And clearly this is why we're discussing the long term, why we are highlighting that more needs to be done, and like meaningful actions must be implemented with the full opening of the borders to the entry of everything. There cannot be a selective decision of the occupying power responsible for genocide to decide which goods enter and which ones do not. So again, the rights of Palestinians are again placed under the control of a dehumanizing and genocidal government. So that said, clearly this is what is killing Palestinians. What is killing Palestinians is the lack of housing. We've documented cases of young Palestinians in Gaza with cancer who had not been transferred south during the massive operation in Gaza City. Their families didn't even know whether they were still alive or not.
Tirza, what's making life or chances of survival harder for patients in Gaza?
I think a very simple way to see this, and it should be it should be a given, and it's not happening. And that's one area that we're trying to focus some of our advocacy is the ability for the residents of Gaza to receive healthcare, whether again it's by having the strengthening of the system in Gaza, rebuilding the system, and also being able to access services in East Jerusalem and the West Bank. It had been an integrated system. You asked beforehand about what's an indicator or an example, and I will give you an example of one person, one child, a cancer patient. One of the hospitals in East Jerusalem that had been providing care for this child before the war had kept in contact with the family, even though the family could no longer access the hospital and could no longer receive care. Come the ceasefire, this child couldn't access any care, and she died recently. So this is why the movement should, as noted before, should have been open, and we're trying to focus some of our advocacy. I think some segments of society maybe even in Israel and certainly international, get it. They can wrap their heads around. Let's create that movement inside and outside from the medical perspective, not only, but let's do that as well. Let's begin with that. Let's see that happening. That's going to be an uphill battle to do something that should be the most, the clearest, something that should have been taken for granted that would happen. And we're focusing on trying to open up for open medical evacuations and relinking between Gaza, East Jerusalem, and the West Bank in terms of healthcare.
Okay, Aseel.
So, adding to what you just said, I think the situation in Gaza from the health perspective cannot be described, to be honest, because you have more than 350,000 people before the war with chronic diseases. And for any patient with a chronic disease to survive, they need medical treatment, they need mental health support, and they need nutrition. And in Gaza, there's absence of the three. They cannot get food, at least nutritious food. They have zero medical treatment or follow-ups. And at the same time, their mental health cannot be described. After the war, many UN reports are saying that more than 1 million Palestinians need urgent mental health intervention. And for me, that's the least that can happen to someone who has been living in Gaza in the past 2 years. In addition to all of this, the long-term injuries. Once you're shot or suffered an injury by a airstrike, it doesn't mean like if you survived that you survived. It means like for now you're alive, but there's a high chance that you will die of complications later, specifically given the healthcare services that are provided in Gaza. And if you survived, you won't live normally as before. You have the amputations. And now you have also more diseases coming up with people with no shelter, no hygiene, no clean water. You have I keep getting a lot of messages from people in Gaza with diabetes. They cannot even get the basic daily dose of medicines that they need. So, and we all know what will happen if the diabetes is left untreated. And we keep getting a lot of messages from people with cancer patients asking for evacuation like they used to go before to East Jerusalem. That's also not accessible now for them. So we're talking about a whole population really struggling daily. Even children with, normal viruses like cold, like flu, they're getting a lot of complications because of the malnutrition and lack of shelter. So we're talking about hundreds of thousands of people who are living in the complications of the lack of services, of the lack of food. And this cannot be measured now. I think since we were talking about the genocide, the long-term implications of a genocide will continue to decades of years to see all these people who suffered so much on their physical and mental health. How will that unfold in the upcoming years?
Let's talk more about mental health, because we usually focus on the physical harm, but the mental harm might be more severe even. What can you tell us about that?
Well, I think the title of our genocide report captures from what was from the very beginning the situation of Palestinians in the Gaza Strip. The title is like, "You feel like you are a subhuman," and this is a quote from one of the very many survivors we've interviewed. Being a subhuman means that your life has no value, and if your life has no value, and we have so many witnesses telling us we felt that we're about to die hundreds of times during the last 2 years. We were evacuated 10 times or 4 times in 4 months, living by the sea with no ability to protect our children, to feed our children. We had mothers who were breastfeeding and were getting no nutrition, so they couldn't properly feed their children. They were pretending, they were giving them water with sage to convince them that there was something that was nutritious. We have families who've seen their entire 3 generations of their family completely destroyed in aerial bombardments or military operations. We have those who have returned from being detained in Israel with horrifying stories of abuse, including sexual violence, and the fabric of society is being destroyed because that is the intent of genocide. When you have these profound wounds in your heart and in your mind, in a situation in which you are alone, then, and you still have, for some parents, they still have to provide for their children in a way or another. They still have to pretend. I recall one of the stories that stayed with me was this woman who was in the peak of starvation. They were pretending, so they were taking out the pots and pretending to make food for the children not to cry. And they would expect the food would come. So these are the stories of Gaza. These are the stories of those who are left behind with no support.
So what can you tell me about the mental health situation in Gaza?
Maybe I'll take a step back to zoom out, understanding the genocide in the broader context of the ongoing occupation and Israel's efforts to hold the Palestinian people, to hold their political national aspirations at bay. And just thinking in terms of mental health of a people and the rights, the right to be recognized as a people, the right to live out political national aspirations fully and equally. This and understanding that the genocide has an impact on the people, and the need to support the Palestinian people in continuing the struggle to be free of oppression and of occupation. So I'm just kind of thinking about what is thinking about mental health in that sense, and translating it into political rights, and where the other sides, whether the international community has to stand in solidarity and to support that meaning of mental health. That's where I'm going with your question.
Mm-hmm. Aseel, would you like to add about the mental health situation?
Yes, because again, we are a locally led organization, so we've been hearing about how people feel since the start of this. And one of the most striking comments that I heard repeatedly was like, people who died in the first month of the war were the lucky ones. They didn't have to witness what others have witnessed. A lot of people were saying that they really wish that they died, but in the culture, it's not allowed for you to take your own life. But that's what really people, what they wished for, because again, not only the fabric of the society was destructed, but the foundation of the mental health of any human being was also destroyed. Like if I want to say I'm okay, it means that my basic needs in terms of food, shelter, security are met. But not only that was not provided, but many people witnessed things that you cannot even imagine. Many people lost tens of family members and loved ones, and they had nothing to do. And they couldn't even bury their loved ones. Many people didn't even find the remainings of their loved ones. And the feeling that Palestinians in Gaza were left alone, that the world has maybe turned their backs on them, even though many people showed solidarity, but I meant political action, that they left them on their own. Really, they didn't feel human. They felt like they have no values of their lives, and the suffering was continuous. Not only continuous, but also increasing by the day. It really felt. They kept saying in a word in Arabic that don't know the right English term for it, qiyameh, Like it feels like they have been sent to hell, like the world ended and people in Gaza were sent to hell because they couldn't express all the suffering that they have been inflicted, all the suffering that have been inflicted upon them.
What policy shifts are needed to be taken by the international community in order to end the genocide, and what the general public can do?
I mean, one of the elephants in the room is the U.S. And the power it exercises, and the fact that I think nothing is a given. Very, very troubling political odds, where I mean, every international stakeholder has its own interests, and where they're lined up right now, and the way the U.S. And the new kind of military intervention and control, as well of civilian life between the U.S. and the Israeli, including whatever kind of tension there may be there. Like, it's not the analysis there, I think, is important, and I'm not sure that we actually hold the political analysis to understand what the prospects are. So I think it's quite worrying, and the attempts to kind of cut away Gaza and make it something separate, where different rules prevail and a certain level of impunity prevails, and a certain level of dehumanization, and kind of, making that, cutting that off. I think that's a big risk and danger.
We need people to call out the crimes. We need people to exactly point out the perpetrators and to see the right means for them to be subjected to law. So I think what we need now is humanity to prevail by actually ending the genocide, by making sure that Israel is held accountable. Otherwise, anything can happen anywhere. Israel will continue not only maybe to kill the Palestinians or make them live in the apartheid system or under genocide, but we're talking about regional implications. We're talking about also global implications on the humanitarian system, on the policy, on international law. So I think now is a really important tipping point in history and how the genocide will be handled.
Recently published a new report called Pull the Plug. That's precisely what we are asking states and non-state actors to do. Pull the plug. Stop providing economic viability to Israel's violations of international law. Arms embargo is the first entry point, because without weapons, there is no war. And we know that this is a very profitable business, but we also reiterate that we cannot profit from human suffering. We cannot profit from genocide. We've listed 15 companies. This is just the initial research that we did. 15 companies which are providing Israel with economic viability for its violations. So we call on states to regulate the conduct of these companies in their own jurisdictions, to prevent them from continuing to contribute or to be otherwise directly linked with Israel's violations of international law.
From a political perspective, from all the governments that are looking for a two-state solution and who are allies to Israel, I think it's vital for the Israeli people, for the protection of the Israeli people, for Israel to be held accountable, because otherwise I think there will be no security for the Israeli people if the world knows that Israel have full impunity. So I just want to say also from a political perspective, for the governments to protect their allies should be held accountable.
I think it's important as well to perhaps talk about what people are doing at an international level. Like, then we didn't really say that the importance of, for example, like 2 years of demonstrations. And the reason why we should say this is because people think that this is not important, but it's actually the contrary. Mm-hmm. It's been like the mobilization of people that's brought some action. So I think it is really important to reiterate that, to call for people to continue their pressure And that's the only way we have.
To that, because I'm finding actually a point of hope that I can connect with.
That's good.
To you. Is on the one hand, there is the sense of time is running out in terms of of lives being lost. At the same time, we do have to take a long view of accountability. So knowing that right now it's very limited, what can happen, and even we mentioned earlier on the fact that there's no real journalism that's allowed in the Gaza Strip, but that's going to change. And there's going to be more and more documentation, and already there has been, and these things are registering somewhere, and there are tribunals that are picking up on this. And so taking the long view and knowing that that's, in the end, those things are accumulating and they are going to be, in the end, litigated figuratively and also legally.